Function with Purpose Podcast. All things health, wellness, fitness, and education through the physical therapy perspective. I am Dr. Amy Bullock, owner and founder of Fortress Physical Therapy. Fortress PT is here to serve the Charlotte metro area by highlighting the importance of how and why physical therapy should be a part of your health and wellness lifestyle. Here we go. Welcome to Season 8, Episode 1 of the Function with Purpose podcast. Dr. Amy here with you guys today. Season 8. I cannot believe, literally, I've been doing this for like 2 years, 2.5 years, something like that. And I'm enjoying it. So for those of you who are listening and continue to listen, thank you. I greatly appreciate it. And if there are any topics or subjects that you would like me to speak upon or give my opinion to, definitely reach out, send me a direct message on Instagram. That is the most interactive platform that I am on. So the Instagram handle is at Fortress Physical Therapy. Okay, getting into today's topic. This is a good one. I rarely do this as a physical therapist / coach. So today's topic, when to tell patients to shut it down. What does that mean? Shutting it down. So, a lot of times, like 9 times out of 10, when patients seek my help, they're either in pain, or they can't perform a specific movement within the gym or a specific exercise because either, their hip is tweaked or injured or painful, or it's stiff, or maybe it's their shoulder, or maybe they're experiencing some neck pain and they can't turn their head when they're driving a car. Very commonly, 9 times out of 10, patients experience a musculoskeletal issue or injury. So that means muscles or joints, muscle, bone, right? So, and movement is involved with this. So basically muscle, tendon, bone, or ligament, and then indirectly some nerve pain or nerve issues. So, when to tell patients to shut it down. So, if something that is performed within the exercise atmosphere or the gym atmosphere, i.e. a specific movement, I'm going to use a prime example because I'm going to tell you a little bit of a story. The barbell power snatch. So if that specific movement performed at high intensity, quick contractions, is constantly performed over and over and over and over throughout the week, and the volume is high, so that means high repetition with those quick contractions. So this is commonly performed in a CrossFit type atmosphere. And you're experiencing a shoulder niggle or a shoulder pain, perhaps in the front of the shoulder. There is 100% chance that you will be ruining your progress both in and out of the gym if that specific, in this example, barbell power snatch is the main thing that is causing the issue to the shoulder. Hence, if we are unable to recognize that, or if you are unable to recognize that, then you're doing your future self a disservice, right? So it's very important to educate our patients when they do come see us. How is their daily routine? What type of fitness or exercise are they involved in? In really honing in and digging in on their subjective inquiry, right? So what are the things that you have noticed from the patient perspective that tend to aggravate the shoulder in this example? So recognizing the aggravating factor, and using a prime example, I've had to recently tell a patient to shut it down. Not tell, I guess, order. This is an order. You are to shut it down. Do I need to write this on a prescription notepad, right? Shut it down. No barbell, high concentric, high volume work. Let the tissue calm down. So, when working with patients who have a mentality that more is better, or I have to get work done in a fast time period, it can be very cumbersome to help them realize that what they are doing, i.e. perhaps the barbell power snatch, is the main thing that is causing the issue to the shoulder. A high concentric load that is fast with a lot of repetition. So education is key in knowing and when to intervene to patients that, okay, this is the thing that I believe is causing the issue to your shoulder. So I think we need to, quote unquote, shut it down so that we can protect your future self, right? Because we don't want to see you enter the medical atmosphere for potential surgery. We don't want that, right? So let's lessen the effects and just put that barbell power snatch in the closet for a little bit and maybe work dumbbell, kettlebell work, or even body weight work, right? So you're doing your future self a favor by avoiding the medical pathway when we know that this is a musculoskeletal issue that's in place. And helping the patient recognize that they need to be in control of what they can control. So super important that we educate our patient. We help them recognize the most aggravating factor. In this specific example, any snatch work or overhead movement that is high velocity or quick contractions for a lot of repetition or volume. We need to avoid that. In that particular example, the rotator cuff is very, very vulnerable to that type of stimulus. And if we don't recognize that as a physical therapist, that, okay, we need to tell this patient and order this patient to shut it down, and then we need to focus on those smaller rotator cuff muscles to calm the tissue. So some of that might be some manual therapy work. Some of that will be some isolation rotator cuff work, but still keeping the patient in the game, in the CrossFit class, and then relaying that message to your coaches that, hey, this patient, we are shutting them down. They are not to put anything over their head. I don't care if they are the fittest person on earth. They are ordered to shut it down temporarily. So, the overall goal to working with patients, in particular myself, is to keep them in the fitness atmosphere, right? And not telling them to shut it down, but there are very rare cases. This is probably, in this specific example, I probably only had to tell patients, maybe counting on one hand, to avoid or stop what they're doing, because that is the thing that is aggravating their shoulder or their hip. So education's very, very key, as well as recognizing and informing the patient the aggravating issue that is causing their, in this example, shoulder pain. Because when we come into therapy and we do some maybe soft tissue work and just some gentle isometrics or gentle isolation of the rotator cuff, they feel better at the end of the session. But then after they leave the session, they're going to go do high volume repetition power snatches, which is the thing that is causing the pain or the discomfort in the first place. So you're basically undoing what we just did in physical therapy to calm down the tissue, get the tissue to be able to relax, and to create a more comfortable environment for that shoulder complex. So when to tell patients to shut it down is helping them and yourself educate the patient, recognizing the aggravating factors. So asking the right questions for the right time and understanding your patient's daily routine, their job duties, how they exercise, where they exercise, how much exercise do they do per day? Are they like a 3-hour everything, like guns out all the way, like balls to the wall per se? Because sometimes too much is too much, right? I'd rather do just enough, but more effectively, right? So ordering the patient to shut it down because that is the thing that is causing the pain in the first place, or the discomfort, or the faulty movement pattern, or their inability to partake into the CrossFit class or the boot camp class. So we have to be able to, as a physical therapist, understand that, relay the message, and then also connect with the coach who's coaching that specific class. So, from the athlete perspective, we have to be smart. We have to be able to recognize that, I want to stay out of the medical system. I don't want to go get an image and this and that. A physical therapist is perfectly capable of assessing a musculoskeletal injury or setback or concern, because 9 times out of 10, that's most likely what the patient commonly experiences. So, I could talk about this for quite some time, but yeah. So, maybe if you're listening to this and this kind of sounds like you, and you're like, oh my gosh, I maybe I am doing too much. Maybe I do need to seek physical therapy and have them help me get down the right pathway to success again, because I want to get back to CrossFit. I want to get back to hiking or rucking. I want to get back to gymnastics. So having a physical therapist or a go-to person to be able to recognize an issue is definitely very advantageous. But from the physical therapy perspective, you as the clinician have to understand and know when to order patients to shut it down at the appropriate timeline. That's a wrap for today's episode, Function with Purpose podcast. For more information on this episode, please check out the show notes within your podcast app. Be sure to subscribe, like, share, or drop your comments and questions below. Follow us on Facebook, Twitter, Instagram, Google, YouTube, and LinkedIn. Thanks for the listen. Pursuit, precision, purpose.